Ebola. This further image is that of a 26 years old female, married 9 months and residing in UK. Ultrasound has been performed there, showing different pathology, different picture as compared to what I am seeing over here. Now, I have frozen this image to show you the longitude, first the dimensions of the uterus. So far as the dimension of the uterus is concerned, it is normal. You see, this is the fundus, the cervix, the body, and this is the endometrial canal. So it measures 8.3 centimeter in length, 3.2 centimeter in anterior posterior diameter, which is within normal dimensions. This is the urinary bladder. This is the longitudinal section of the uterus. Now, on this side, right side of the image, you are seeing a transverse section of the uterus. In this, you will see two echogenic linear areas. This is 1, this is 2. Now, this is endometrial canal number 1, and this is endometrial canal number 2. So there are two endometrial canals seen in transverse section, coronal section, and and you see the outer surface does not show any indentation, so it rules out bicornuate uterus. So I'll go for a subseptate uterus with two endometrial canals, and when we will scan in longitudinal section, you will note that the cervix of is 1, vagina is 1, cervix is 1, body is 1, but then there is diversion of the endometrial canal into 2. So with no indentation in between, this is a case of subseptate uterus and type 5 Mullerian duct anomaly that we say, and this is the right ovary, this one, with no follicular activity in the right ovary. So now let me show you all this on real time right now. Now first I will place it in, I will get the uterus in transverse section. This is the transverse section, and in this transverse section you can see that there are two canals, two endometrial cavities. Yeah, here, and you see that this is the myometrium, transverse section of the uterus, and the echogenicity of the area in between these two canals, endometrial canals, is the same as that of the other myometrium. The distance between these two is, the distance between the two canals is approximately 9.4 mm, and in transverse section the size of the uterus is 6 centimeter, and normal should not exceed more than 5. So this is our first study. Okay, now whatever we get, we should straight away see that and then move on to the other study. This is the left ovary, this one. This is the left ovary showing you no follicular activity. Right was also showing no follicular activity. See, this is the left ovary. These are the iliac vessels as per the landmarks. Here. So clearly seen, these are the iliac vessels, this is the ovary. Now we come to the main study. and that relates to the endometrial, two endometrial canals, normal echogenicity. Now what I am going to do is I am going to take this cavity in view and then make it longitudinal. This is the transverse section of the uterus. I am going to use this endometrial cavity, this canal, and going to 90 degree, give it a 90 degree sweep, keeping the canal in the center, and here we see a full longitudinal view of the uterus. Okay, now this was the one that I showed you on the right side. Now the left one. This is the left one. Now I'm going to do the same maneuver with this, keeping this endometrial canal, right-sided endometrial canal in the center of the screen, and now I'm going to give us 90 degree sweep, and here we are. So you can see that both, now if you study the uterus is normal inside the endometrial canal. The division of the canal is here. This is the canal number, say 2. This is the canal number 1, endometrial cavity number 1. And at the time of ultrasound, it's 3. It measures approximately 4 millimeters. So this is in fact a case of, this is how we can prove that this is a case of bicornuate uterus. Let's do it again. Let's focus this endometrial canal and this one, and now I'm going to give a sweep to the probe. Here it is. Here it is. So this is our, now again transverse, keeping this one, the second one in the center. I am going to give a sweep to the probe, and here we are with it. Let's do it with the other one. This one. This is the second one. Now I am going to give a sweep to the probe, keeping this one in the center, and you will see it will separate from the other one. And if I give a sweep to the, now another interesting phenomenon. Here you are seeing the uterus in longitudinal section with one endometrial canal. As I angle the probe posterior towards the right side, here comes the other one. 1 and 2. With maneuvering, I can get both. This one. See? 1, 2. So this is a case of subseptate uterus, and the cause of her not being conceiving so far. Now here I can see both ovaries, and I can easily show you again. This is the uterus. Its length 6 centimeters. Endometrial canal cavity 1, endometrial cavity number 2. This is the ovary. This one, left ovary, and this is the right ovary. This is the urinary bladder. So this is our case of the day. Thank you very much.